We are very, very fortunate to have Dr. Evelyn Ho all the way in the USA.
And less commonly, you have other types of breast cancer that can arise from other tissues in the breast. Now, the most important thing you need to remember, and I've boxed it in yellow, is that the body has a delicate balance of acceleration and braking systems. Just think of your car where you press on the accelerator and the brakes. Now, what causes cancer? Actually, nobody really knows the exact cause. Meaning, what are we trying to say? In other words, if I tell you not to do X, Y, Z, you won't get breast cancer, or not to eat A, B, C, and you won't get breast cancer. That is something that we still do not know exactly one particular factor will cause breast cancer. We do know about risk factors. We do know how breast cancer can grow. Maybe we know the trigger, but again, that is not quite. So this is one of the questions that we ask, and this actually are real questions that patients tell me when I have to break bad news to them. What did I do wrong? And they will put their hands and their face all together, and they are like really, really upset, because one of the most unusual thing I've heard, and that realized that how people feel when they get a bad diagnosis, is that he actually was worried about what people would think of her, because they would say that I didn't take care of myself. Now, this kind of thinking, I want to tell you to not put that into your mind at all. You are not to blame for anything that you have. Because who gets breast cancer? The majority of people have no known risk factors for breast cancer at all. A small proportion may have some risk factors which they are aware of, but most of them do not know. So the next question that people ask, and this is again something that a patient told me: I breastfed all my 3 children. I had my first child before I was 30 years old. I jog 3 times a week. I feel very healthy. Why am I having breast cancer? Everything that she did is right. And if any of you here haven't had cancer before and are doing all these things, managed to have your child before 30 years old and are exercising, please carry on doing this. Because when you talk about risk factors just means that there is a risk of getting something. It does not equal 100% chance that you will get it because you didn't do something or you did something. It's just like driving a car. It is risky. There are possibilities of accidents, but we don't go into a car going from A to B thinking that, oh no, we're going to get into an accident. And the majority of women with breast cancer have totally no known risk factors. And I want to reiterate it more than once. And we'd like to divide breast cancer risk factors into 4 groups. One, which I will not talk about, is definitely not related, but you can ask questions later. One where you have totally no control over, which I will go through. The other one, which is lifestyle, will come where you have some control, and the maybe risk factors are the ones which are very controversial. So why do I say you have no control? Being born female is the single most important factor why you can get breast cancer. Now, men can also get breast cancer, but they only have a 1 to 5% chance comparatively. And of course, the other thing we can't change is that we grow older every year. And when you get your first period, when you get your menopause, these are totally also partly out of your control, unless you do surgery to do that. We will come across that. You can ask questions. And all the other little factors on the other side, past history of breast cancer, dense breast, you really do not know most of the time until you've already had the breast cancer. Then, of course, I have a past history of breast cancer. I have higher risk. So this is where early detection is the key. And today we do not have the time to go a lot into early detection, but you feel free to ask at Q&A time. Now, why do lifestyle questions arise? This is where we feel that when we have control, it makes us believe we can shape outcomes and events to our liking. So unfortunately, by doing that, what are we trying to do? It's like trying to raise children. We do our very best, but there is no guarantee they will be successful in life, or they will not turn to drugs, even though we try very hard. So to a certain extent, once you have expectations which are beyond what is under control, this is when we make ourselves unhappy. We have high blood pressure, we have anger, and it may hurt decision making. Maybe you really love doing something, but you are afraid that it may give higher risk of cancer, and you stop doing it, and your life is miserable because of that. The same with COVID-19. So now some old people are very unhappy that they are forced to stay home for their own safety in COVID-19, right? But on the other hand, they are saying, what is life? I do not have many more years left. If you don't let me go out and live life, then I might as well not be living. So that is another way of saying that this is not something that they want, but this decision is being made for them in some way, or because they feel that they have to do their part. So this is just an example in COVID-19. So these are some of the risk factors that we can control. We know very well that alcohol, which is enjoyed by many people, does increase your risk of breast cancer compared to someone who doesn't drink. So if you don't drink alcohol at all, don't. So this is another way of saying that if you did not have the enzymes for alcohol and you turn red with alcohol, it's not a bad thing. It is a good thing. So this is where you capture the thought and twist it into something positive, because it is preventing you from taking something which may increase risk side effects. Obesity is when you grow really fat. And this is particularly important if you have already menopause, because a lot of the estrogen after we menopause comes from fat. And of course, estrogen can stimulate cancers. The other one is if you sit down all the time and you're a non-exerciser, really love your remote controls and binge watch TV, that is one risk factor. And of course, this risk factor of no children at all, or having your first child after 30 years, is also not so easy to control. You cannot go out there and say, I'm going to get a baby now and I'm going to deliver it before 30 years, right? Nowadays, people do not get married so early and do not have children so early. So to a certain extent, you can control, but a certain cannot. Right, this other one is hormone replacement therapy after menopause. I need to mention this because if you really have serious side effects, or rather the effects of going through menopause, you can't sleep, you have serious hot sweats, you are drenched in sweat, you have got irritability that is driving everybody up the wall, see your doctor and take your combined or plain estrogen, all depends on whether you have a uterus or not, on what type they prescribe you, and take it for the shortest possible time so that you can ride out the difficult phase, so that your quality of life is better. And this is where you take benefit is better than risk. Now, one word of caution about bioidentical hormones, which they claim is exactly like your hormones in your body, unlike the other types. Now, if it is exactly like the hormones in your body, we take it that it will have the same actions like the hormones in your body, which are the cause of increased risk if you are having prolonged exposure to estrogen. So why is it that early first period and late menopause becomes risk factors? Because that means that you have many, many cycles of your menstrual period, your menses. And then if you have that, then it means you have more exposure to estrogen, which is why we try to tell you, take the minimum required, do it if it is good, better for quality of life, but do it and be aware. And of course, early detection comes in if you're on hormone therapy for at least longer than 5 years. If you didn't breastfeed, again, it's a lifestyle thing because not many people are into breastfeeding, although it has come back into fashion. Do not breastfeed to prevent cancer because the link is very weak. You have to breastfeed at least 6 months to a year. Breastfeed because it's good for a baby and good for you. Of course, oral contraceptives is another one where having a baby accidentally when you cannot cope anymore or have too many to look after well is going to bring more disadvantages and advantages. So you have to take oral contraceptives, again, the lowest dose, and do not worry because 10 years after you stop taking it, you go back to what another woman who has never taken oral contraceptives have. So it's again a slight risk factor. And of course, breast implants for women who feel they need it for aesthetic reasons, and the other group for reconstruction after they have removed their breast. And this particular type of lymphoma only tends to occur after 5 to 10 years, and only with the furry or the fuzzy kind of breast implant. So again, this one is not like other lymphomas, and it can be easily detected. If you have one, do not panic and remove it. Just make sure that you undergo regular checkup. The third one is, I am very fit, I exercise regularly, I eat healthy, yet why do I have breast cancer? So all this is right. If you are doing it, do not stop. Now, exercise is very good in the sense that it has many benefits. It releases your happiness hormones, it gives you better mood, reduce your stress, higher energy levels, lower risk of heart disease, diabetes, more muscles, lower fat. basically is good general health. And if you exercise with friends, and you can do this, you can do a WhatsApp video and exercise together, even though you can't be physically together, or some people walk alone for de-stressing. Whatever you do, it will release more oxytocin. So they have found out from many studies that if you increase your physical activity, you do reduce your risk of breast cancer. And if you have breast cancer, it reduces your death rate from your length of life after breast cancer. That means you have better survival. And if you see those little words down there, it means that there is a lot of complex interplay of events going on in your body, growth hormones, sex hormones, body fat, immune function, and inflammation that causes this. So now for the exercise people in your group, all right, any of you love exercise, here is an American College of Sports Medicine guidelines for exercise. And you find that exercise has been known to reduce the risk for 7 different cancers, such as bladder, breast, colon, womb cancer, esophageal cancer, kidney, and stomach cancers. And if you already have 3 cancers, exercise can improve your quality of life and maybe lead to a better survival. So that's breast, colon, and prostate. For overall health, they have something like 30 minutes 3 times a week and resistance exercise as well. So in other words, they have frequency, intensity, time, and type of exercise for those who love numbers and like to do this. I know people who are super serious in exercise, and this works for them. And even during your treatment, you have exercise prescriptions for different aspects, and some of them are evidence-based by study.
The question, oral contraceptives is a risk factor. What about IUD or other contraceptive methods?
Oral contraceptive methods. The IUD, nobody has really studied. It also releases in small amounts. So because we have no study, we can't tell you the answers to that. But I do not think you need to worry, because the risk of having an accidental baby is a lot of psychological stress. And if you're not ready for a baby, if you already have 4 or 5 children, for some people it's already more than enough. So the benefit outweighs the risk, just like when you take hormone replacement therapy. If that did not answer your question, you can ask again. So now high interval intensity training are for those who do not have so much time to devote to exercise, right? People spend up to 3 hours a day exercising, but this is not for everybody. So you find that 3 minutes a week or even 20 minutes 3 times a week is much better at weight loss. It improves your insulin. Now, insulin is a hormone that is involved in the control of your blood sugar. So as you know, that is related to diabetes. So high interval intensity training, that means fast, your heart rate goes up, you have breathlessness, your heart rate goes up. That is what we mean by aerobic. And then after that, you slow down, and then you go up again, and then you slow down. And this actually improves your fat stores, reduce, builds muscles, you improve your overall cholesterol profile. But, and this is news, why some people may not benefit from exercise is that during the period of studying and researching into HIIT, as it's called, you may have inherited genes where you are a non-responder to the cardiovascular benefits, that means the heart and the health benefits of doing exercise, including the fact that some people are averse to exercise. One word and caution is extreme sports. It's not for everybody. You have to make sure that it's done properly for training. And if you're running marathons, the Missouri Medical Association actually calls it an unhealthy addiction. Remember, I said exercise gives you good hormones, happy hormones. So sometimes too much of endorphin gets you addicted. Rain or shine, they are out there running. So now, what happens if you can't do all that? What about maybe I do the 10,000 steps? But 10,000 steps is a very interesting phenomenon, because it's all over the place. You have Fitbits, okay? The pedometer means something that measures how many steps you do. And after a while, people are actually jiggling the pedometer just to make them feel better that they're doing the 10,000 steps, okay? And it's a real thing, because I've met many people who say, I didn't hit 6,000, let me jiggle, 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 especially if they're doing it with their friends. So actually, there is no scientific basis to 10,000 steps. This magic number came because a Japanese company decided to put the Japanese character for a man walking, as I show there, and they called this device Manpoke, and that particular character is for 10,000, and that's where the 10,000 steps come from. And what happens with this is it creates guilt, it creates fear, because I didn't manage my 10,000. Oh, I didn't do 10,000, therefore I'm going to be unhealthy. No, it does not make do anything of this sort. And also, you need to know, some of us do not have neighborhoods to walk in. Right now with COVID-19, you can't go out. Not everybody has a treadmill machine where you can run at home or walk at home. And some of us have injuries or we have arthritis that prevents us. In that case, you can just stay physically active by doing anything. If you like dance, you do dance. You can have many exercises on the chair. You Google it. It's all there on YouTube. And they found out that in a study for even elderly women of 72, all you need is 4,400 steps a day compared to 2,700, which is a woman who doesn't do anything, who sits still, or a human, any other human being who sits still. You find that just this little increment, not even related to you walking fast or walking very hard or rapidly, immediately brings you significant health benefits. So people have challenged all this. I must do 150 minutes or I must do 10,000 steps. So even the slightest increase in physical activity. So do not despair if you're not the exercise type. Just make sure you're active. Do housework if you can. Don't use your remote control. Park your car further away. But now with COVID-19, you have even more difficulty if you're staying in a small apartment, how to do it.
Dr. Ho, I would like to add something here where you have in the past when the women were not in jobs, when they were not in
Yes.
Formal jobs, and they were usually in the house cooking and cleaning and walking around. They actually did see that the scientists were saying women used to walk more than men because they were like everywhere in the house and outside the house, and they clocked in a lot more steps, and their heart was much more preventing or even reducing risk of heart ailments and heart conditions compared to men. So is that something that has changed over time because women have now acquired a lifestyle similar to men?
Yes, that is true, including smoking and drinking alcohol. In the old days, the women used to fetch water from the well outside, right? So they had to carry. And when I was working in Kuching and in Cebu, the women who came, the natives, or rather the ones who were out there in the fields, they will come immediately after childbirth, walking. Amazing. We could not believe how strong they were because they are working in the fields. So that has changed. So that's why we have to, not to become men, because men have their own issues. We can just make sure that we stay active. We do things, we get up, we try not to use the remote control. Maybe we can do more housework, because housework is actually very, very good. And there's also HIIT, that means high interval intensity style of doing housework, so that you get even better benefit while keeping your house clean. So this works for a lot of, I think, career women as well who may not have maids, because maids are not easy to get and they're very expensive. So there's the different ways in which we can. Some people now have the table where they can stand sometimes when they are doing work at the desk or at the computer, and other times where they can sit. They have cycles for you to sit, although it's a bit difficult cycling and trying to concentrate and type at the same time. So now we talk about stress. This is where a whole new industry of wellness comes in. And I love to distress by watching comedies or looking at pictures such as this. This is a great way to distress. So you can practice mindfulness, meditation, laughter yoga, exposure to nature as sunlight. Thankfully, in most of the countries where we are along the tropical, we have plenty of sunlight. In fact, so much we grumble. So we should be thankful that we have sunlight, because in countries where, say, Norway, where they have a lot of winter is like very few hours of sunlight, and even summer also is not as long as other places, you find that without the sunlight, actually their mood is depressed, as higher risk of depression. So, however, you do not need to spend money to go to a wellness spa. If you like, if you have the ability, you can get a present from your friends who can group together, and you enjoy being pampered, go ahead, because it does help you to reduce stress. Now, stress is a very, and along with stress, I'm going to do this. Was it what I ate, or was it what I didn't eat? Was it the pesticides in my food? I only eat organic food, even antioxidant supplements, yet I got cancer. So what is it? So this is where we move into the maybe risk factors. These are the controversial risk factors. And why are they controversial? Because it's very difficult, for example, pesticides and chemicals, to prove it, because we have a lot of bodies which make sure that any chemicals in whatever we eat, even for the vegetables, I just watched a documentary from Channel News Asia, how they check the chemical levels of the vegetables and reject when it's too high. So the same with the recently, I think many of you who eat this high blood pressure pills or even cholesterol, the ones which are generic, they found that one of the chemical contents was too high and could be dangerous. So they immediately inform you. So there's no way also we can do studies to show proof that it's linked to cancer because it's not ethical. We can't use pesticide to test whether it will work. So the only test they have done is in the lab, in the petri dish, in the tubes, or at the most in animals, which is again, the group of people do not like you to use animals for experiments. The other area is diets and stress. So high soy diet has been known to have conflicting results. Why? Soy is a plant estrogen. When it gets into your body, it behaves like normal estrogen. And what happens is that it will bind to your estrogen receptor. And the strange thing about soy is it can act both as estrogenic or anti-estrogenic. So the studies have been totally conflicting. Some say that if you start taking soy from young, it protects you. If you already have breast cancer in an adult age, try to avoid high soy products. And when I say avoid high soy products, I will mean people who take soy supplements. It's fine if you drink soya bean once in a while, you put tofu in your food, that's totally different. But when you take soy supplements, it's extremely highly concentrated and we do not know how it works. High-fat diet, also they could not prove with 100% certainty. And of course, stress and antioxidants, which I have to talk about. Now, smoking, they could only prove again in the laboratory. In the case of night shift workers, they have noticed that increased risk for breast cancer in both women as well as men night shift workers, but they can't replicate the same study all over the world. So because of that, they are in the maybe risk factors, all right? Now, stress, a lot of women link the cancer to stress, and researchers, doctors have all heard you. It's not that we disbelieve you, but we have been doing so many studies, and when I researched for this talk, I was surprised at how much studies there were. However, it is very difficult to research because so many factors are involved. Stress is related to a lot of other things. What is stress to person A is not stress to person B. And secondly, some of us are born with innate better coping capabilities than others. So what happened in the old days when you were a caveman and there were dinosaurs? What happened? Or when there were wild animals? Your brain tells you, I perceive danger. It goes and tells your adrenal glands, which are glands on top of your kidneys, to produce your stress hormones. And once you have the stress hormones, you are able to run for your life or you can fight for your life. So what does it do? It raises your blood pressure, it raises your heart rate, it increases energy supplies, increases sugar in your bloodstream, enables your brain to use this sugar that's circulating. It increases the substances which are used to repair any damage you have. And it also shuts down non-essential functions. It also can alter mood, motivation, and fears. So because of that, we are able to protect ourselves and survive. However, what happens is if this doesn't get switched off, normally it gets switched off. It is when it forgets to switch itself off, there's something going on, there's ongoing sustained stress, then you find that the negative impact of stress comes on. Now, this curve was described in 1908 by two psychologists. And they found out that if you have no stress, you're dead bored. For example, you have COVID-19 now, you're all sitting at home. Some of people are dead bored, they have cabin fever, they are miserable, and they can also have mental health issues. The other group is if you have sustained stress, you get burnout, you feel unwell, you get a lot of sickness that goes in it. So there is actually a special area of just nice stress where your performance is maximal. That means you're able to perform well. Remember, I told you right at the beginning, your body is a system of acceleration and brakes. So, and this is where you need some stress in your body so that you perform optimally. And this is a very big study on 106,000 women in the UK, where they actually followed them from, say, day one, and then looked at their stress levels as they go on. So this study is considered powerful. They don't have to worry about what they did in the past. So this very large study could not also show that there was any evidence for breast cancer risk, and any perceived stress that they had in earlier childhood also could not show any risk. So this is why I mean that we are in the maybe risk factors, because we can't prove it. And the reason why we can't prove it is along the way, we do not know whether these people have the same coping capabilities. Maybe the diets were different. There's so many things that is impossible to study in human beings. This is what we know. If a person who feels stress does these things, eat poorly, smoke, drink more alcohol, lack exercise, or lack sleep, you find that these will then give rise to risk factors that are known to be associated with not just breast cancer, but many other cancers. So in addition, you get a lot of digestive problems, headaches, heart disease, you have weight gain, you have memory and concentration impairment. So it becomes a very vicious cycle because this will stress you even more. Now, before we go on, we need to relate all this stress also to free radicals, right? Everybody has heard about free radicals because a lot of supplements are telling you to take the antioxidants to get rid of the bad guys. In fact, free radicals is like a dirty word, but I'm here to show you that free radicals is a must in your body. Now, these are unstable reactive compounds that contain oxygen, and what they do is they attack all the good things in your body. Now, if you look at the one corner, and I put it in the white rectangular box, exercise produces free radicals. All right. So why is that? Dr. Ho just said exercise is good for me. Of course, not extreme, but here exercise can produce free radicals. And if you look carefully, the mitochondria is referring to, I would say, the car engine of your body. All right. So every cell has mitochondria. What does it do? What it does is it converts the food that you take into energy, and then your car can move so that your body can go ahead and does what you want to do. So in other words, if you do not have this process, you cannot function. It is a normal function, the production of these so-called free radicals. And the other thing I want to show you is that when you have, say, an infection, you have white cells coming and they attack your bacteria or your germs or COVID-19 for this matter, and it produces inflammation. And yet this inflammation is essential. The free radical is what kills the germs in you, the one to kill and make them go away. It also is used when you remove dead cells in your body. Now, you know very well that nothing can live on forever. So who removes all the dead cells in your body? So your own body has its own system of Dewan Bandaraya or the municipal trash collector to make sure it is removed. Smoking is known to cause damage. Air pollution, sunlight, particularly the ultraviolet light, and that's where you get your skin cancer. And also in patients who have had cancer, when you have radiotherapy, that is the precise reason why you are having radiotherapy, to kill whatever remaining cancer cells there are. So it's very important for all of you who have cancer and who are undergoing radiotherapy to tell your doctor what you are taking, because your antioxidant can reduce the effectiveness of your radiotherapy. So free radicals are therefore very important. They are not dirty words, and they may be protective against oxidative stress. So now you're thinking, how is that so? Because it has to have a feedback cycle to tell your body, hey, it's time not to produce so much. And you, in this diagram, it shows you the blue, light blue box tells you that your body produces its own chemicals. You don't need to do something outside of your body to detoxify yourself. Your body detoxifies yourself, and this glutathione is one of them, which is produced in your liver to neutralize free radicals. And it also, body knows how much to absorb from the food. It's very unlikely that, like in the purple box where you have too much antioxidants, instead of protecting you and neutralizing free radicals, it starts damaging you, because the same antioxidant can now act as a pro-oxidant, which is why more is not better when it comes to antioxidants, because you get very concentrated forms in supplements. And we have also found out from a lot of research going into this area is that you need slightly more of these free radicals so that there is a low level of stress, and your immune function then can function very well, and your cell signaling, all this feedback that goes on. Remember, you have brakes, acceleration, it does properly. So the million-dollar question here is, when do I supplement and how much? So we still haven't found out how to measure in each individual what is your level of oxidative stress. If we could, then we can tell you how much to supplement. We do know, however, that as you grow older, your ability to regulate all this does not work so well, which is the same. As we grow older, everything doesn't work so well. So because of that, we find that all the studies on antioxidant supplements have been disappointing so far. So you have situations where Smokers must avoid beta-carotene supplements because it increases your risk of smoking-related cancers such as lung cancer. If you are a woman, I would be careful about antioxidants because it increases your risk of a type of skin cancer. Vitamin C and E increases your risk of death from heart disease if you get it for women. And we find that it either does no benefit or it causes some harm. And some people have even developed acute selenium toxicity. So a few things about antioxidants as well. Number one is it may not absorb as well as you think it should. It may not work the same as in test tubes or lab, which is where they have tested it. Some may be toxic, and you must tell your doctor as well, even if you are not having cancer, any antioxidants you are taking if you have to take other medication, because you can cause prolonged bleeding with blood thinners. So these are the facts that we know as far. So it has been really disappointing, even though marketing and supplement companies may tell you otherwise. So where do you get your antioxidants from?
Dr. Evelyn Ho, so the question here is you're talking about supplements which are usually in the form of tablets and in the form of something in liquid form that people are buying and using it. What comes in your diet is your natural source. So this is something else that we are talking about. These are supplements that you're talking about, right?
Yes, I'm talking about those which are powderized and purified and extracted and comes in tablets. It can be a coenzyme Q10, it can be selenium, it can be vitamin C, it can be A. Any of these vitamins are also considered. So that's why I'm coming into this next slide on where do you get your antioxidants from. I'm not saying don't take it, but I'm saying take it from food, because when you take it from food, it's very difficult to overdose. Your body knows how to control how much to take. And they have also found out that if you purify the substance, it doesn't function in the same way. So in your fruit, in the apple, the antioxidant in apple works together with a lot of other chemicals inside that apple. Vitamin E, for example, in any of the tablets, very difficult to find the 8 different chemical forms in a supplement. It is very difficult to get. And even in your 8 different chemical forms, you're not even sure that that is the only thing that's why it works. Is it something else that triggers it to work better? We do not know. So, and we have definitely studies have found out that you need a very large intake of whole fruits and vegetables for benefit, which is where juicing has come around, because everybody says, I can't eat a kilogram of vegetables or fruits a day, but I can juice everything into one. But unfortunately, juicing does not also give you the same benefit. It removes certain things when you juice, and sometimes it may give you an overdose in the sense that you get the side effects of diarrhea and bloatedness, much more than you were just to eat the natural food, because like I said, it's very difficult to overdose. Nobody also knows whether it's just the antioxidant or is it because it acts with other things in the food that makes it very useful. So no one is 100% sure, yet marketing is telling you is take this and you won't get that. To me, there is no such thing as one particular superfood. Everything that you eat that is whole is a superfood, right? So what do you need to do? Just make sure you increase more plants in your diet. And you do eat lean meat, you must eat your seafood. If you're a vegetarian, make sure you get your protein sources. So grains, nuts, vegetables, eggs are very, very good antioxidants. Make sure you have color food. That's how you can help. Don't have to remember everything. Variety and color is what you need. And you must avoid processed food as much as possible. Now, I love sausages. I do give myself a treat now and then, but I try to avoid eating it unless I made the sausage myself. Then I know I didn't put in the nitrites and the preservatives. If eating organic will motivate you to eat a lot of fruits and vegetables, then go for it. But you do not need to specially buy organic food because number one, it's very expensive. And I think in COVID-19 right now, we need to be aware that a lot of people are having a lot of economic hardship. So do not feel that you are shortchanged if you don't eat organic. Wash your fruits and vegetables more. The other thing is just to wash a lot. But of course, washing also leaches minerals. So that's why in everything, there is a balance that is not easy to manage. We try our best and don't knock yourself for it. So in relation to diet, I have to talk about obesity, because obesity is when you're really, 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 really fat, not just slightly overweight, plump, maybe you look a little bit big. Do not worry about that. We talk about obesity because studies have shown that it is fueling many, many more cancer cases a year, and it's not just breast cancer, okay? This is a lot of cancers. And fat is, again, another very interesting organ. It has two main functions. It behaves like a gland, and it's not just what we all used to think, oh, it's just energy, so I grow, I eat too much, then it converts into fat, then I just do liposuction and I'm done and I'm good. It doesn't work that way, because your gland actually has the ability to turn processes in your body, metabolism, reproductive cycles on and off, constantly is sending out information. So remember, I told you this system of brakes and acceleration also works in your fat. So the three main theories how obesity can cause inflammation. If you look again at the word inflammation, you have seen it before because I showed it in free radicals. You need it as part of immune system. Too much is not good. So what happens when you have a lot of fat? Cells have to die, right? And they have to be removed. So your body will come in, Dewan Bandara will come in, your trash collector will come in. And by doing so, it also increases and tells I'm removing dead cells. You need to produce more. Healing has to occur. So this is upset. You have fat, more estrogen is produced. It definitely promotes womb and breast cancers. And then if you upset your metabolism, again related to insulin, the one that regulates sugar and growth factors, you again promote cells, which will then divide and grow. So you upset all your balance, and you are actually promoting the negative effects that comes with having too much fat. But you need to have fat. Now, don't go away thinking you need to be super skinny, and then next thing I know, you're on this massive dietary regime or exercise. You need to know that you need fat in the right places, because with appropriate fat, you actually lower your pro-inflammatory. That means the things that encourage inflammation, you lower it. You increase those which are anti-inflammation. Your appetite can be regulated properly, and then you have proper metabolic function. Now, when we are talking about fat in your body, then what about dietary fat, right? So for dietary fat, what you do therefore is to try to eat more monounsaturated and polyunsaturated fats. These are the fats that tend to be liquid at room temperature. And when I say room temperature, it will be tropical room temperature most of the time, or in a place where it's not dead cold like the Arctic or Antarctic. So you want to limit your saturated fat. What is saturated fat? Saturated fat tends to mostly come from animals, but not necessarily so. It is also found in milk. It's also found in palm oil. In fact, it's found in all oils, but to differing levels, okay? And don't forget, just because avocado is good fat, I can binge on avocado, then don't be surprised if you put on weight because too much fat. Right, so fat is very complex. You have healthy obese people, you have thin and unhealthy models where they have too much fat in the liver, so fatty liver, or you have chronic inflammation. You expect all obese people to have it, but yet it's not the case. And all not obese people have abnormal metabolism. So we know fat is complex. So if you are on the big side, but you are healthy, do not panic. Try to eat healthy, but don't make it obsessed about, I have to lose weight. So obesity increases risk of many cancers, but it also increases risk of many other diseases that actually kill more people in the world, which is high blood pressure, strokes, diabetes, and indigestion makes you very uncomfortable. And of course, nowadays, fat shaming, which is people making fun of fat people, is not encouraged, but it still happens whether you like it or not, particularly if you are a teenager and in school. And finally, I have no family history. How can I get breast cancer? This is the reason, because you are born female, the single biggest risk factor, and because early detection is therefore the key. You cannot say that if I have no family history, how can I have breast cancer? And these are the facts. All right, family history only exists in a small proportion of women who have breast cancer. In other words, when we pick up all the women with breast cancer, ask them for family history, many of them don't have. Now, when it comes to family history, take note that it could be a father or a brother. So breast cancer can also be transmitted through the father or the brother who has breast cancer. And of course, you can inherit certain genes that give rise to higher risk of breast cancer. Does not equal. When we look at races in Malaysia, Chinese more than Indians, more than Malays. If you look at the whites, Caucasians, more than Asians. And if you look at North America, among the Caucasians, it's more than African American, more than Hispanic. So that's because we see these racial differences, we have been trying to investigate, but it's not so simple. Because why? Diet plays a role. What they do plays a role. Where they live plays a role. And being taller also has been associated with higher risk for breast cancer. And being taller may also be inherited from your family. If you have a whole family of tall people, it's very rare to see a short person, but you can, because gene inheritance is very complex and it's out of my, for today, it's impossible to cover it. Now, when you talk about hereditary breast cancer, they are able to isolate specific genes, which are sections of the encoding of your genetic material in your body, the DNA. So there are sections of these which are called genes. And these gene mutations, the most common you have heard is BRCA1 and 2. And what happens is that instead of helping your proteins repair, you don't have them. So you have a deletion or a mutation in it, and it doesn't work. But just because you have it doesn't mean you're going to get breast cancer. Maybe by the age of 80 years, 20% may still not get breast cancer. So therefore, it is a very complex thing, hereditary breast cancer. And the only reason I'm showing you all these others is because we had a question the other day and in another BCWA seminar where a patient had, a lady had a different kind of mutation, which was not BRCA1 and 2. The reason for showing you is to tell you that there are a lot more genes than we know and we can explain. And we know some of them causes certain syndromes, which causes more than just one cancer, many types of cancers. So what we want to do is to attend a genetic counseling clinic even before we consider tests. A lot of women say, oh, I want to know because maybe then I can prevent it because I can do something about it. Maybe I can do what Angelina Jolie did. Okay, because of Angelina Jolie, tests have become more popular and more patients have been asking it, but it is not for everyone. And why is that so? If you test negative, you may go away with a false sense of security thinking that you're safe, which you are not, because the majority of women do not have this inherited risk factor. You may cause guilt because now you're saying, oh, I better not have children, or because I can pass to it, or I may not get married. So these are decisions that may not make you happier in life. You worry, you're anxious, you fear your future. And your relatives may not be happy because you went and did the test and they didn't want to know that they have a possibility that they should be tested as well because they also may carry the strain. And finally, you may be discriminated against by your employer because they are thinking, oh, it's high risk to have her employed. I may have to start looking after her and pay money for her treatment. So these are things which you need to consider, in addition to the fact that the test has got other limitations. So one of the cause of preventive treatment, now what Angelina Jolie did was to remove her breasts and reconstruct it. She also removed her ovaries 2 years later, 2013, 2015. Just to let you know, that costs a lot of money. 2, you have to go through the pain of surgery. You cannot guarantee that you're going to be like her, have no complication. You may get infection, your surgery may be infected, you may have your outcome of your reconstruction may be ugly, and it can happen because of complications. You lose fertility. Hey, I'm not ready yet. How many of us will be willing to adopt children from several different countries, right? It's not possible for everybody. And finally, you need to know you have only reduced your risk of breast cancer down from 80% to maybe 5 to 10%. So it's not a done deal that I do all this and I won't have breast cancer. I can forget about it. I can remove my ovaries and forget about ovarian. In the case of ovaries, it's better, but in the case of breast, it's not possible. So to reduce the risk of breast cancer to 5 to 10%. So in summary, I would ask you to choose wisely. Food, colorful, more plants in your diet, but make sure you have enough proteins, whether you're vegetarian or otherwise. Do not smoke if you haven't started. If you do, try to cut it down as much as possible. Target for healthy size. I did not say be thin. Did I not say I did not want anyone to go away today thinking that they are an unhealthy weight? If you are slightly plump but you are healthy, carry on. Do what you need to do by avoiding alcohol, limiting it. If you love it, it's fine, because remember, some people say red wine, and that some people are researchers. Red wine may help your heart. So there you see how controversial food can be. And of course, be as physically active as you can. Dance, because it makes you happy. Run if you like. Spend time with friends. Socialize. Care for yourself. Make sure you rest. Make sure you have enough sleep. And of course, be breast aware. Both men and female can be breast aware so that they can find if anything is wrong, go get a checkup. I strongly recommend for stress, and in this world right now, COVID-19 is causing a lot of stress, whether we like it or not. And even without COVID-19, the world is far more stressful than the old days. Laugh more. Find things to laugh over. And try to capture and twist your negative thoughts into something more positive. Look for positive reasons for whatever is happening. It's very different from being positive. Being positive suggests that if you get something, it's due to the fact that you are not positive enough. But being positive has to come with the fact that you're realistic. So being realistic is not being negative. That's why I use the word look for positive reasons For example, COVID-19 has caused our climate to be better. Air pollution is down. Wow, great for my lungs and great for not producing too many free radicals. That's what I mean by capture your negative thoughts and twist it and let go of your need for control, because it is unfortunate. I'm also a control freak. I know what it is like. And this was happened when I get too much into needing to control, and now everything is unpredictable. So the other thing is that because we are inundated with so much news, I found it was very, very depressing to listen to news. Everything about COVID-19 is bad. So what I do is do not listen to any of the news. If I want, I be very choosy. I go to, in my case, I read journals because I know then it's trusted. It's not spun. It's not scaremongering. Limit your exposure to social media. It is unfortunate that people try to help, but when they forward messages, some of them are really, really frightening. It's not just in COVID-19. It happens in cancer, happens in dieting, it happens in supplements, and then you end up falling prey to it. So these are some of the things that you can do to really help yourself reduce your risk of breast cancer. And if you already have a cancer of any sort, to be able to not have a recurrence or have a different cancer, and try to have good quality long life.
Thank you, Dr. Evelyn Ho. That was really, really food for thought early in the morning for Malaysians.
Dairy farmers often inject a lot of growth hormone into their cows to produce more milk. How does that hormone-related breast cancer or ovarian cancer?
Okay, so in theory, what they do in milk, and there are some studies on milk, and the reason I didn't raise milk is I do not want you to remove a good source of calcium and protein. And but it has been shown that because the cow is lactating, right? Lactating means you have hormones, more hormones, otherwise you can't have breast milk. So all these hormones that are taken in can come out in the milk of the cow. All right. So some studies have found that it may be linked to an increased risk of breast cancer. It may, but it is very complex because the study showed that if you drink milk, it might, but then the cheese didn't. So that doesn't make sense. So is it, do you ferment cheese? Is that the reason why it doesn't work? So it's very complex. When you look at food, it is a very complex matter because we do not know how the chemicals are. If you look at dairy products, there are so many types of dairy products. There are so many different types of cheeses. Is the process in which they make the cheese, is that the reason why when they tested that cheese, it didn't increase your risk by taking cheese? So it is another one of those controversial. That's why diet comes under the maybe risk factors.
Another question, Dr. Evelyn Ho. Hi, Doc. How to prevent breast density?
Oh, breast density is, again, you're born with it. So the only time you hear this density is if you have had a mammogram. And we usually will tell you that, oh, your breast is very dense, or, by the way, density, dense means more glands and fibrous tissue compared to the amount of fat in your body. I have thin people with fattier breasts, not as dense as you think, and I have fat people with dense breasts. So although it's related to amount of fat you have, it doesn't mean that if you're a very fat person, you are safe, that you have a very fatty breast. You do not know until you do the mammogram. So usually after the mammogram, most doctors in Malaysia anyway, but not in US, will immediately tell you that, hey, you have very dense breasts and that we should supplement your mammogram with ultrasound. Okay, so that's why you hear that we do the ultrasound to try to help the mammogram be better at detecting what it has to detect. But the other thing about mammograms is to compare it, and not all dense breasts are the same. Some dense patterns, so the pattern of the breast, which I didn't show today, is actually there's no two women with the same breast pattern. So we need to compare it with your old mammogram if you have one. If you don't have, we start at baseline and we carry on from there. So not all dense breasts are the same. You can't, I have patients telling me, if I put on weight, do you think my breast will get less dense? No, answer is no. Because if you have the fifth type of dense breast, okay, so if we classify dense breast into 1, 2, 3, 4, 5, the fifth type of dense breast, no matter what you do from young until old, your breast will stay the same. Very, very dense, meaning that you never age. There is another group of dense breasts where as you grow older, more fat will come and take over the glands because you stop needing to get pregnant. You do not need to breastfeed. So what happens then is all your glands will be, shall we say, atrophy, that is, grow old, and it's replaced by fat. And then there's the other group who from young already tend to have fatty breasts. But your amount of body fat does influence it to some extent, but not as much as you would think.
Yeah, you're talking about being breast aware, right? And I know you're supposed to go and like examine your breast, etc., on a regular basis. But if when we age, and let's say we're past menopause, then the question is, what is your risk for breast cancer, and should we continue to do that? Because you're right. I mean, as you age, I mean, I find that my mammogram shows that the breast becomes more dense. So the question is that if you are past, let's say, on past menopause, then what are your risks for breast cancer, or you think that it's because you have reduced the estrogen, your risk should be less?
Okay, very good question. But however, let me correct one thing. What I meant is that for certain types of people with dense breasts, their pattern actually gets more fatty with age. Older you grow, more fat replaces, because you do not need to produce milk, because you're not going to get pregnant after menopause anyway. So your body knows how to reduce the amount of glands and fibrous tissue and replace it with fat. But there's a group of people where the dense breast doesn't change from young until old. That is the pattern they are born with. So to a certain extent, we inherit the type of breast we have. So your question then is, does the risk of breast cancer drop because we have menopause and no more estrogen cycles? You are absolutely right. In a sense, it does. But age now becomes the big factor of why the risk goes up. So it doesn't really drop a lot. But in Asian countries, we find that the risk goes up after menopause to about 60, 65, and then it doesn't keep going up like in Western countries. In Western countries, it keeps going up, but not in Asian so far. We have found that it actually starts to drop slightly. It doesn't come down very low, but it does drop slightly. So we still haven't found out why. That's why there are a lot of studies going on. I think Cancer Research Malaysia in Malaysia itself does a lot of studies which are more focused on Asians. Okay, so what happens is that because the risk of cancer goes up as a result of aging, even though we menopause, you still should be carrying on your screening mammogram. Now, most studies say you should go on until about 70 or 75. And some bodies, such as the American College of Radiology, they suggest that you should do mammograms if you have 10 years of good life left, which means you have to kind of like decide, your doctor has to decide, oh, she's very healthy, she's doing fine, she's very independent, we can carry on. But there's another school of thought who says, nah, so what if you have 10 more years of good life? If you spend 6 years of it under chemo or treatment or something, and your deterioration and quality of life. So that part is very controversial, but most people will go up to about 75. Having said that, I have met quite a few people or discovered cancer when they were older. Then in that case, it doesn't apply. You have to carry on your surveillance because you were just diagnosed with cancer at 72, and we have to make sure that you stay cancer-free. And I've discovered this in more than one person who is in the 70s.
Is there a need for elderly women above 80 to do breast mammogram or ultrasound annually?
Number one, do not do ultrasound annually because it is not a proven screening method that helps. In the older woman, anybody above 40 or 45, I definitely will have to recommend the mammogram before I add the ultrasound, because there are many things that we cannot tell on ultrasound so well. Number one, you cannot get a big bird's eye view of what kind of pattern breast you have, which we can use to help advise you what is the next step. Number two, we also need to be able to see everything. When you do ultrasound right now in the majority of centers in Malaysia is handheld ultrasound. So it takes time to do. It depends on your breast. It depends on the interest of the person who is doing it, the time enabled. So an ultrasound for screening does not work in the same way as a screening mammogram. It definitely can help in certain types of patients for certain. The other thing is above the age of 80, usually if she has been well all throughout, she doesn't feel a lump or anything, it's okay. I think if you reach 80, if you feel something, you definitely must go and get it checked out. But I would not say you need to go for your screening mammogram, unless there's a specific reason for it. Okay, for example, you're BRCA positive, that's a different story. But I think most people who live until the age of 80 are, most of them won't want to live to 120, but I cannot speak for everyone. So every individual, once you hit 80, is an individual decision.
Okay, another question. will skin cancer happen on the removed breast?
Skin cancer on the removed breast, that means after the radiation. I think that's what they are trying to say, right? But usually if you remove the breast, mastectomy, they don't radiate the bed of your surgery site already. So when you talk about skin cancer, I'm not sure you're referring to due to irradiation. Not common. Sometimes the cancer that occurs in the skin is due to the breast cancer recurring. And once they biopsy that, they find out that it is actually related to your breast cancer. So I personally have not found that to be a case. I have not personally seen any case of that nature.
First, Dr. Evelyn, thank you for the talk. Excellent. Love it. Very informative. Second, about the milk. I love milk, but I try not to take a lot because of the, the known side effect. Spices like the cumin, the curry and all that stuff that counter the so-called negative effect of milk and yogurt.
Okay, the studies on curcumin has been equivocal, meaning that it didn't show that it lower the risk for cancer. That means they did not observe it with the curry, okay, the curcumin. Although there is a lot of, in the lab, they can show that there is anti-inflammatory effects. And I think some people who are taking it find that it helps with the arthritis. So we do not know this. I don't have the answer. I'm just observing this because milk theoretically has got estrogen. And therefore, could that be the reason why there's this email or viral messages saying that you don't take, and there's people who are saying that because they stop milk products, therefore, or they don't take milk products as well, they don't get breast cancer. I will tell you that people who do not take anything or who does all the right things can still get cancers. It may not be breast, but it can be any cancer. And then because you are thinking that if I don't take milk, I won't get breast cancer, you'll get very upset. That's what I mean by you need to manage expectation. It's far more complex than just the milk alone. It may have to do with your body, how your body metabolizes things. Maybe you do something else that you're not aware of that causes your systems of brake and accelerators to be slightly out of tune. Yeah, I have no answer for you there, basically. But I'm just trying to balance the thinking about all this. I would say go ahead if you love milk. If you can have milk, great for you. At the end of the day, you don't want to have osteoporosis and fracture easily. At the same time, you do not want cancer. So it's not easier. So moderation is still the correct thing to do. And it has been time immemorial. I hate to use the cliche, but moderation has been what we have always been taught. Your balance doesn't mean that it is 50-50. Your balance just means more plants, less saturated fat proteins. Doesn't mean you don't eat.
Another question, do bioidentical hormones increase risk of breast cancer?
Okay, I tried to address it just now. We have to assume it does because the bioidentical group of people, the people who promote it, who develop it, say that it behaves more like our natural estrogen that our body produces rather than the synthetic ones that you take as hormone replacement therapy. But if that's the case, if it behaves like the same thing in your body and your own estrogen is the one produced by, say, your fat is the one that increases your risk of getting hormone-positive breast cancer, then don't you think bioidentical hormones are exactly like your hormones? If your own hormones cause breast cancer, then bioidentical can cause breast cancer. That is how I would think logically. There is no way that if something is natural doesn't mean it doesn't. Remember, everything in our body has to work in a specific way according to their own system of check and balance. So if we disrupt it because we are sick, yes, of course, you need medication to help you because you're sick. But if you are relatively well and you're trying to make yourself better well, if there's such a word, much more well than well, then you may upset that balance because you are interfering with how your body is dealing with all these check and balances.
Next question is, will there be any pain felt when touching a cancerous lump in the breast?
Most of the time, no. Most of the time, no. Cancers tend to be painless and you feel totally healthy. Let me tell you that. Cancer in the early phases, which has not spread anywhere, you are actually very healthy. You can do anything you like. Even if it's spread to the armpit and you can't feel it, you feel perfectly fine.
Yeah, come back to the question with hormones. Now, the hormones from cows or hormones from plants like the phytoestrogen or bioidentical hormone, after we ingest it, won't they get digested like other protein molecules?
Oh no, what happens is that when it gets into your body, is a plant estrogen, right? It then gets metabolized and then behaves like the estrogen, which is why if you take a lot of soy supplements, my patients come in with breast pain. If they take a lot of wild yam, because it's being marketed for improving your breast texture, especially after menopause or after childbirth, you find that your breast is floppy and droopy, and you want to pad it up and make it more firm. People who do that, number one, is they feel a great difference. They start having breast pain.
I'm currently receiving chemo treatment and my weight has dropped from 57 kgs to 45 kgs. I have been advised to take protein powder as a supplement. What is your view on protein powder as a supplement?
Okay. In your case, you have lost too much weight, and it's probably related to your treatment and the fact that you cannot eat as much as well as you can. So in this case, this is to supplement what you cannot take in orally. So in this case, you do not apply to what we were saying, get all your nutrition from real food. You have no choice but to take this to help supplement until the time comes where you can eat normally again. And you cannot lose too much protein because then you have other problems. I'm sure your blood must have showed that you have too little protein in your body. The other thing you can try is to eat egg albumin. That means you take away the egg yolk. So you take 4 eggs and maybe you take only 2 egg yolks. The albumin is good protein, easily digestible. Maybe that's something you can take. But I've met people on chemo where a lot of things they cannot eat. So in that case, I tell them, if you can eat ice cream, eat ice cream. If you can't, if you can eat anything you like, you eat, if you can. So in this case, protein powder, if it helps you build back some of your protein and muscle, then you need to do it, because the more muscle you lose, the less well you tolerate the chemo. Is a vicious cycle.
Yeah, the other thing about is that, of course, whenever most of us were having chemotherapy, if we couldn't take a meal, we did take the protein powder as something to replace that meal so that you don't go empty stomach and you get weaker and weaker. So you definitely need the protein powder to replace the meal that you're missing. So it is not risky to have this supplement because this is advised by our medical team.
And it's different. It is replacing what you cannot eat. So for nutrition in cancer, it's a completely different ball game altogether. The nutritionist hopefully will advise you how to improve your nutrition. So it's not like a normal person. The talk that I gave is for people who can eat normally and can make decisions of that nature. So check with your nutritionist, because some people can't even tolerate the protein powder. So you need to check and see how are the different ways in which you can trick your taste buds into swallowing or your stomach into accepting food.
Actually, I've been eating quite well. It's just that the weight is just keep dropping. So that worries me a little bit. I eat a full meal. So I've got no problem with appetite.
You probably need to get yourself checked to find out the reason for the weight loss if you're eating well.
Okay.
Dr. Evelyn Ho?
Yeah, I agree. Check with your nutritionist and then with your doctor to see why. The fact that they ask you to add protein powder, it could be that you think you're eating well, but your body is still burning off more calories than you can take in, assuming that it's not due to some other cause. So your doctor to say such a thing means they have excluded some other cause, could be the effect of all your treatment and the fact that you are now recovering from it. Am I correct? You're recovering from it, Chin Chin?
Yes. She's saying because my body is waking up, so the metabolism rate has increased. So it's burning off more than than it's being absorbed.
Okay. And this is what I notice with my patients is that they lose so much weight, and then after that they have to try to keep putting weight back. Right? They start eating, and after that they can't stop eating, and then they put on too much weight. So don't worry, sooner or later you will get your weight back as long as your appetite is good. Try to eat a little bit more than you need, but be wary about the weighing scale, because after a while you love your food so much and you missed it so much. I do have some of my patients unable to stop eating.
Is that okay?
Thank you. Thank you.
chemo patients can eat eggs.
Can.
It's cooked. Make sure it's not raw.
Yes.
Make sure it's
Do
not.
not eat. During chemo, you try to avoid raw salad, please. You need to eat everything cooked.
Anything raw. Don't eat anything
Don't eat anything raw. Everything must be fully cooked.
Cooked, yes. Your egg should be fully cooked, and it is a wholesome meal. The egg is one whole meal by itself, which gives you so much nutrition.
Yes, and the egg yolk has a lot of these trace minerals and all the vitamins which you may not be able to get. And remember, the egg actually contains a lot of antioxidants. In my research for my talk, I was surprised to find out that eggs have lots of antioxidant in it. So, and then don't worry, because the antioxidant is not at the level where you're taking concentrated in a supplement. So you should not worry that it's going to impact your chemotherapy. Actually, the egg protein in the albumin, the egg white, is one of the best proteins around. It's a simple protein. It's easy to digest. So if you're on chemo, if you can trick your mouth to enjoy egg white and you're worried about too much egg yolk, like I said, take 4 eggs, just do 2 egg yolks. Throw away the other 2 egg yolks. Or give it to someone who can afford to eat it.
We have a question. Hi, doctor. For breast cancer patient, can I take the original enzyme?
What is an original enzyme?
I have no idea.
Okay, I'm afraid there's so many supplements out there on the market. Most of my patients have to show me the name and everything, and I will have to Google what it is most of the time. Because there's so many things, and they use the word enzymes. Most of the time, these are also part of the antioxidant cycle, like coenzyme Q10.
Yeah.
I presume you're referring to things like that. Yeah. They are related to helping your metabolism in the antioxidation, to neutralize things, to improve your function. So I'm afraid I do not know the answer for that. But if you're not sure, please ask your doctor so that they can check to make sure that it doesn't interfere with your chemotherapy. Like I said, as long as you're taking anything in tablet form, you have to consider whether that is going to interfere.
Is it necessary to take organic eggs?
Okay, I have to tell you, all human beings have...
If I had to take organic eggs in my life.
I personally, I will not spend the money on organic because a few reasons. Not because I think that it's bad, but because I cannot trust that when they say it's an organic egg, it's organic. Which is the body which is certifying that it's organic. And what is true organic? True organic means not only the feed that you give the chicken has to be organically produced. It cannot, yes.
The chicken must be organically produced from another egg also.
Yes, so it's very difficult to have food. So in fact, if they are eating feed that is not organic, then your chicken is not organic anymore.
And if that chicken's mother was not eating organic, also not organic.
So it's very difficult. So that's the main reason why I do not believe in the organic story, because the nutritional value is the same. In organic substances, they are saying that they do not use pesticides. So they use urine and manure, right? But if the urine came from a person who doesn't eat organic food, it is also not organic. Because it will also contain pesticides. It will also contain all the chemicals that he's taking, because they are using urine and manure. So it is very difficult to have a 100% organic cycle. And you must have a body that certifies, that goes and check them and make sure it's truly organic. So the only organic food I tell you is, if you can rear your own chickens, then you know what you put into them. You don't give them antibiotics. That's why kampung chicken costs more, because it's free range, it's running around. So all you, and yeah, and grow your own vegetables.
Yeah.
If you can.
Yeah. And depending on what you're going to put for the manure.
Hello, I have the opposite problem of the lady earlier who said she's lost a lot of weight. I actually have very good appetite, and actually after the 3rd chemotherapy session, I actually felt a spike in my eating. I kept feeling hungry. I've checked with my onco. I was told that it's probably the steroids that's actually promoting my eating. So actually, just between one chemo cycle alone, I gained 1 kilogram. I was a bit worried because earlier on my breast surgeon told me to watch my weight. but my onco actually says that they're happy that I'm eating, and as long as I don't gain too much weight, and there was no like limitation on what sort of foods I take, as long as I'm eating the normal foods, not supplements or Chinese herbs. May I have your views?
First of all, it's fantastic that you are responding this way to your anti-nausea vomiting treatment, which is why your steroids are there sometimes. If you can do some exercise, you can go to the American College of Sports Medicine, and they have actually prescriptions for exercise. You don't have to follow exactly how many minutes, but you can get an idea what kind of exercise you can do to keep yourself as healthy as possible. I think one of the most important thing is that you lose muscle when you stop eating and stop moving so much, or you're having severe nausea and vomiting and you lose weight. Now, they have found out that people who lose muscle actually don't do so well after chemo and all that, and the chemo makes them weaker much faster. So keep your muscle bulk going by doing the strength exercises. That means not just aerobic. You need to do some resistant exercise, not to carry 20 kilograms of weight, but to do, say, hold a bottle of 500 mils or 1 liter of water. You just don't have to buy dumbbells. You just use your 1 liter bottle, plastic bottle, for whatever you had it for, maybe Coca-Cola or whatever, if you treat yourself. And then you fill it up with water and you use that. You can buy elastic bands to help you do the resistance exercise, to stretch against it. Or you just do push-ups vertically. That means not on the ground where you have to lift up your whole weight. Just lean against the wall and you can do push-ups. That is what we call by strength or resistant exercise. So that keep your muscle bulk going. The steroids can make you very puffy and make you think you're putting on a lot of weight, because there's a lot of water retention as well. Because 1 kilogram for such a short time is a lot of weight, and usually steroids can do that. And I think once your steroids are over, you will find yourself losing that weight quite rapidly.
Yeah.
I'm actually less concerned with aesthetics or the bulking. I'm a bit more concerned with does putting on weight affect the effectiveness of my chemo and overall recovery, because you mentioned about the fat cells and how they affect our cancer.
Yeah, okay. In your case, it's a side effect of your treatment, and that will go away once your treatment has gone. So once your treatment is over and you find yourself much heavier than you are, not just a few pounds heavier, then you can then start on a dietary regime, meaning not as in eating very much less food. Eat in such a way that you have more vegetables and less carbs, and then you carry on with your exercise. That means you can do things for which you can try to get your weight back to a healthy level. Not so much aesthetics, you're right. But what we are trying to say is that do not become very, very fat after your treatment is over. During the treatment, because as Ranjit says, the medication you're in, for some people, they lose a lot of weight. The other group can eat, which is great. Because the one that cannot eat, I think, damages more, because when you don't have enough nutrients, not just your muscles, your bones also get affected.
Can cancer patients take collagen supplement?
I would suggest you do not take any supplements without checking with your doctor first. Your onco especially. But collagen supplements, like I told you, collagen cannot, if it is real collagen, number one, you cannot absorb the collagen. Number two, collagen in your skin and in your body has to be made by your body. So for example, if you take no fat at all, your liver has to make the fat for you. Why? Because every single living cell in your body, the covering of the cell is from fat. So if you don't take any fat at all, your poor liver has to work very hard to produce the fat for you. So yeah, the exercise during chemo, you go to the American College of Sports Medicine. They actually have it in detail at which phase, if you are suffering from cancer fatigue, what type of exercise. If you are suffering from nausea and vomiting, what kind of exercise. They actually have a prescription for it based, and they will tell you when there is no evidence, so then they cannot tell you everything, but they tell you there's evidence to suggest it helps. So if you ask that question, definitely you can, but be careful what kind of exercise you do, because it really depends on your situation. So you can use that as a helping guide.
In this COVID-19 pandemic, are we considered as high risk or vulnerable group? We are referred to cancer survivors who are no longer undergoing treatment, like after years past initial diagnosis, surgery, and treatment.
I would like to say you are like a normal person.
Yeah.
It's the most vulnerable population are the ones who are on chemo right now, those who are on immunosuppression therapy for transplanted organs, such as kidney transplants. They are continuously on organ suppression. You are on immunosuppressants for life. Okay, these people are at high risk. You have kidney failure, you are also at high risk because you do not function normally. Your immune system is also not normal. So if you are totally healed from your cancer and you are leading life like normal, there's no evidence of anything at all, I would say you are normal risk.
During chemo, can I eat meat? Meat is proteins. Just remove the fats and don't have too much fats on the meat. Eat the proteins. You need that. That repairs your body cells. That generates new cells. That helps in your body health as well. Okay, so and your muscle, everything comes from there.
Yeah, you need the digestion. After it's digested, the contents of meat is used to help repair, build muscle, build a lot of things. So you need proteins. Food as a direct, that means I cannot tell you do not eat meat and you won't get cancer. It doesn't work that way. So that is why I say that nobody really knows the exact cause of breast cancer. We only know risk factors.
All right, we have a question here. Do Chinese cancer patients have to totally avoid preserved food?
Okay, you're talking about the Chinese love preserved food. You don't have to totally avoid it, but because it has high salt content.
I would like to correct that, Evelyn. I would like to say it's not just Chinese patients, Chinese people who eat preserved food. All races have preserved food, from the Caucasians right up to the Asians and Africans. We all have some form of preserved food that we eat.
Correct. So you have yogurt, which can be considered as preserved. You have got sauerkraut, which can be kept for a long time. You have chutney, the Indians eat
chutney,
yes.
pickles.
So it depends on what kind of preserved food you're talking about. I would say more likely is the high salt content that you have to be careful over. So I love salted fish, which they say, oh, maybe associated with this and that. So I try to eat less of it because it's high in salt, but it does make your food taste pretty good. So sometimes when you are undergoing chemo, when your tongue doesn't feel like anything, you need really strong food, then there's no harm having some salted fish to help you be able to eat your food.
Yeah. So the preserved food, the only thing sometimes we tell patients that cut down on preserved food during chemotherapy is because there is no nutrition in it. So if you take more of the preserved food, your tummy is taking the space of what should have been healthy food inside your body to help with the repair. So you must remember that we're not saying don't take preserved food. We're saying that the preserved food doesn't have the kind of nutrition that fresh food has. So if you already have access to fresh food, take that. And as Dr. Evelyn Ho says, it is okay to help your taste buds by eating a little bit of preserved food, and that gives you that appetite to eat and the taste to have the rest of the food. You're eating your rice and your meat and other things. You want some taste, put that little preserved food together and have that. It's fine with that. But you need to know and need to be educated that preserved food do not have nutrition in them. Can we have breast treatment with chemo and together with TCM?
Yes, you can go to Pusat Institute Cancer Negara, and they have the TCM ward, or rather department, next to the main one. So this is where you get integrative medicine as such, and they know when not to do what. So that you need to have it integrated. You can, if you wish to have it, you have to tell your doctor so, and get referred to where you can get it integrated, so that you don't do something against what the other one is doing. Then you waste your time and money and suffering from the side effects of the chemo or whatever medication you're on. Even the herbs do not necessarily be tasty, not necessarily tasty either. And they may also have its own side effects. So they have to be worked together if you want to try that. So most women will do one treatment and then followed by the other. But if you want integrated, it has to be done properly. So IKN has it in Malaysia.
So what Dr. Evelyn Ho is saying, that Institute Cancer Negara has, the oncologist can refer you to their own TCM doctors. You should not be going from your oncologist without your oncologist referral to somebody outside who is not working together with your oncologist. So you have to make sure of that. Am I right?
Yes, because you don't want it to negate each other's effect, cancel out each other's effect.
Yeah.
It's very important. So they need to know what each other are doing. So you do have some doctors who are trained in both Western medicine and complementary traditional medicine. And it has to be, of course, done properly so that they know what they're doing. So if you choose that, but we don't have too many, but I know IKN has, because I've met the doctor who does it. Based on the Q&A, I have to premise and preface it so that you understand that when we answer your questions, it's based on what you ask. We do not know the whole situation that you are in. So please check with your doctor. That's the most important thing I can tell you. If you can get referrals to a nutritionist, that will be excellent. Then you can ask them a lot more questions because their expertise is in all these little details about the food that you will be thinking of wanting to take. Don't just Google on your own, because unless you know which website to go to, and I suggest the American Cancer Society website is a very good website. The information they give is very good. If you're in Australia, you have the Australian Breast Cancer Council as well, so you can have that. Or you can go to places like Harvard University itself. You have to actually go there. Don't Google and then find out that you have been diverted to somebody who's trying to sell you some other supplement. So these are the places where you choose to decide what to read, and these are the information which you can believe and you can trust. I think most important is whether we can trust.
Dr. Evelyn Ho, we are coming to the end of the session. Thank you so very much.
Thank you very much to BCWA for doing this, and thank you all of you for being around.